All right, hello everybody. Welcome to our next lesson here about in our unit here. Excuse me, sorry about different states of consciousness. So for today, we'll be looking at the effect of drugs on consciousness. So objectives and standards to explain how drugs can affect the mind and body, and analyze treatment for drug abuse. Take a look at the standards there as well. And our desired result: how do different drugs affect the mind and body? So the central nervous system and psychoactive drugs. Interactions between the central nervous system and psychoactive drugs can alter the behavior, mood, and perception of a person. Psychoactive drugs can range from stimulants like caffeine, such as in coffee or soda, to depressants, such as in alcohol. In the body, drugs are taken through the bloodstream, they're taken up in various tissues, and then they impact neurons and send chemical messages, causing them to fire or not to fire. And this results in different reactions by different drugs. So here's some categories of some different psychoactive drugs, and you can actually use this for the assignment on Wednesday as well, because a lot of these categories I've listed here are things that you can make your poster on. So we have depressants such as alcohol. The effects of that are relaxation, but can cause impairment in memory and judgment. Tranquilizers, barbiturates, benzodiazepines, and Valium and Xanax. They induce sleep. They can help with anxiety, and they are muscle relaxant. Opiates, examples are heroin and morphine, reduce attention to the real world and decrease pain, but they often have an unpleasant withdrawal effect. Stimulants such as cocaine, amphetamines, and caffeine create an increase in energy and alertness. 5. Mixed stimulant depressant. Example is nicotine, such as what might be in a cigarette. The brain activity is typically stimulated, although many smokers say that nicotine actually causes relaxation as well. 6. Distortion of experience. Example, marijuana, THC. Your sensory experience is intensified, but it can impair learning and memory. It often creates a distorts perception of time, but it can help with glaucoma and nausea. And then number 7 is hallucinogens. Again, examples are LSD and mescaline. Sensory distortions, hallucinations, and it can also create panic as well. So again, please feel free to use examples here, and we'll talk more about some of these throughout the lesson for your poster you'll be doing. So the effect of marijuana. The use of marijuana is legal and acceptable in some cultures. However, in the United States, it is illegal. In marijuana, the complex molecule tetrahydrocannabinol, did my best with that word, THC is more commonly just called, is the active ingredient, and effects can be pleasant, such as feeling happy. Senses are also heightened, such as you might see brighter colors, or food may have a stronger flavor to it. However, marijuana can also cause unpleasant feelings as well if a person suffers from fear, depression, or unhappiness. Marijuana also has some possible health effects, such as cancer and reduced memory function as well. Now, withdrawal. Hallucinations may occur if a person is addicted to a drug and they suffer from withdrawal. Uh, these can also occur with normal conditions with hallucinations, such as when a person is dreaming or suffers from a lack of sleep. We can have hallucinations. For example, sometimes truck drivers who are driving for a long time on the road can have hallucinations if they don't get enough sleep. And daydreams can also feature hallucinations as well sometimes. Now, the effect of hallucinogens. They are given their name due to the effect of causing hallucinations. They're found in plants around the world, and they've been used for their effect of the consciousness for hundreds of years. They're also known as psychedelics since they can cause a loss in contact with reality. The most well-known of these is LSD, lysergic acid diplamine, and using the drug causes sudden and increased changes in perception, such as a person may witness changes in familiar shapes. For example, one of the examples I saw earlier was a person may think a wall is, moving or shaking when the wall is not really moving or shaking, or the wall may seem to bend or, change shape if they touch it. Users can also have increased hearing. They feel that time is accelerating or slowing down. It can cause impaired thinking and logic, and it can also cause fear as well. Now, the effect of opiates. Maybe you've heard opiates is a big focus of current events right now. Many people around the country have, or many states around the country have programs to fight the effect of opiates and the struggle against people who become addicted to it. So opiates is a very hot topic issue right now. Morphine and heroin, excuse me, are typically the most common opiates. They can produce pain reduction or euphoria. This is why many people are becoming addicted to opiates, because opiates are found in a lot of pain medications, such as somebody has surgery or is suffering from some type of pain or disease. So a lot of people become addicted to opiates because it helps reduce pain, and then unfortunately many of them move into the heavier drugs of morphine and heroin, which are obviously more dangerous. A person can feel almost like they're in a state of asleep and awake sometimes when they're on it. And like I said, the use of opiates can lead to physical addiction. And like I said, big problem in our country right now. Now, the overdose of opiates can lead to a loss of control in breathing, which results in a death from respiratory failure. Excuse me. The effect of alcohol is the most commonly used and abused drug in the United States. Alcohol makes people feel relaxed and happy, but it actually is a depressant, so it actually serves as a depressant on your neurons in your brain. And the ability of a person to make good judgment decreases with an increase in the amount of alcohol. So if a person is drinking a lot over a short time period, obviously their good judgment calls are going to be reduced. Signs of this could be blurred vision, slurred speech, and impaired memory. Like you might ask somebody a question, they might say, "Oh, where did I put my keys?" And you say, "I told you where you put your keys, 5 minutes ago." So if they're drinking a lot, that could be a sign that maybe they're, a little impaired. There could also be permanent liver and brain damage from alcohol abuse as well. Now, abuse and treatment. Most people have taken a psychoactive drug at some point in their life, even if it was a soda or coffee, since it contains caffeine, and caffeine is considered a psychoactive drug because it has a different type of impact on our brain. But a drug abuser is a person who uses illegal drugs on a regular basis, or someone who excessively uses legal drugs. And there can be different reasons for the abuse of drugs, such as to gain self-confidence, maybe to forget about their problems, or to simply just feel good. They, want to feel better or feel, different. And obviously, you've probably learned this as well, that drug abuse can result in health problems, injuries, and even death sometimes. Now, those who abuse drugs, treatment involves the following steps. 1, a drug abuser must admit they have a problem. 2, they have to enter into a treatment program or therapy. And then 3, a drug abuser must remain drug-free, which is very difficult for drug users sometimes. But these are the kind of 3 basic steps they need to follow in order to, get out of their abusive ways. All right, so please try your best on the questions that follow, and I will see and talk to you soon. All right, everyone, and our closure for this lesson: how do different drugs affect the mind and body? Think about alcohol, marijuana, hallucinogens, some of the other types of drugs that we talked about in the lesson today. How do they impact the mind and the body? What's the impact of them? And I'll help you answer your question. Hope you have a great rest of your day or night. Please let me know of any questions or concerns, and I hope to see and talk to you all soon. Take care. Bye-bye.